Hello and welcome to the new Indoor Environments Global Research to Action program. I'm Bob Krell. I'm the publisher and founder of Healthy Indoors magazine, and I'm co-hosting the show along with the president and current president of the Indoor Environmental Quality Global Alliance, Don Weeks, coming to us live from Ottawa. Hi, Don.
Yes, all the way overseas in Ottawa.
All the way overseas. So anyway, this is our first inaugural broadcast. So thank you for joining us. This will be a monthly program. Interestingly, this is a joint collaborative project between ISIAQ, the International Society of Indoor Air Quality and Climate, and the Indoor Environmental Quality Global Alliance. Both organizations have gotten together to create this broadcast, and we'll be bringing it to you every month. So this is the first of those efforts. So I guess my first question, Don, is let's talk in terms of how this came about. I know this was it's kind of a new concept for a program.
It is. The two organizations who were aware of each other and wanted to work on something together. So we formed a memorandum of understanding, which actually is relatively new. We did that in April, with the intent that one of the first things that we would do jointly would be this podcast, and the purpose of it is to basically take the research section part of indoor air quality and to present that to the practice, so that actions can be taken based on good research and on good science. And this, as you mentioned, is the first of that. This one is sponsored by ISIAQ, and the one that we will do in late July will be the first one by IEQ-GA. So I'm looking forward to having this broadcast go forward.
I mean, and this certainly is a little bit of a new tack, I think, for both organizations, right? Because we're bringing, our intent here is to bring academia and research and introduce a lot of the great work that's going on globally to the entire indoor environmental community worldwide. So,
yes, and that's true. So between the two organizations, we have members, both of us, in a variety of different places in the world, probably as much as 45 different nations. So this is really, truly a global commitment from both organizations to reach out to people who are working in the indoor air quality field in any part of the world.
So today, our inaugural episode, we have two guests coming to us from Denmark and from the Netherlands, right? Joining us today will be Pawel Wargocki. He'll be our first guest, and followed by Froukje van Dijken, coming to us from the Netherlands. So we have the comment area in the global community. For those of you who are watching the show live right now, you're more than welcome to post some comments, and we will try to entertain those throughout the course of the show as well. So I guess without further ado, let's bring in our first guest, and I'll let you do the intro, Don.
Hello, Pal. Yes,
no,
you're right.
It was kind of an abrupt entry there.
Okay, so Pal, how are you today?
Oh, I'm good. Thank you very much, and thank you for an invitation to this new initiative. I hope it will be very successful. It's a new way of how we can introduce indoor environment and bring it to the many people. We now all are very much interested in our indoor environment because of the pandemic, but we should be interested independently of the pandemic as well. So I think that this will be one way of communicating the importance of that. I'm pleased to be here because of several reasons. One is that I was the president of the ISIAQ, and I also participated in the first discussion when the Global Alliance was formed. I remember we were sitting with Don and a few other people on the initiative of Professor Bill Banflett, at that time the president of ASHRAE, to initiate some sort of a global alliance that will bring together, societies that deal with the indoor environment. And this is an initiative that brings ISIAQ and Global Alliance in the form of some sort of a program, not webinar, but some sort of a program in which we can introduce different problems related to indoor environment and some solutions as well, hopefully.
Yeah, that's the intent. And perhaps you could let us know, how did you become interested in indoor air quality?
Well, my life is full of unplanned events, so that was not planned event actually. And I don't want to take much time. I graduated from Warsaw University of Technology, and towards the end of my studies, I came to Denmark, and I met a group here where I work now, and particularly Professor Fanga at that time, and I got interested in this. It was completely new for me, and so I decided to come back. I came back a few years later, started my PhD here, and then I completed it, and the center was formed here, International Center for Indoor Environment and Energy. I got my first, employment here, and then so I continued. But certainly it was the curiosity of how we actually, it was a learning process. I started with a very simple studies on the effects of fragrances on how they can mask pollutants in the air. But then this led to another interest in how we perceive air quality, then led to another interest in how that relates to our symptomatology, and then how it relates to how we work and learn. So that's, it's the constant process of exploring new. And this is the most interesting in it, is that basically we do all the time something new and make small steps to learn more about different aspects of indoor environment. This is so attractive.
So I remember you gave me some of your cited papers, and two of them that you co-authored were on sick building syndrome symptoms and productivity. Can you tell us what were the conclusions of those papers?
When was it that I gave you those papers?
Just a couple of weeks ago, I think.
Okay. Right. I mean, we are speaking about schools, right?
Yeah, we will be talking about schools. Sure. If you,
right. So what we did is, actually we did more than that, but I will start with those two papers which are published. We have also some report that we recently published in Denmark only, and probably we will make it, I made it available also over the LinkedIn. Mm-hmm. But nevertheless, our interest was to identify what are the effects of improved thermal environment and indoor air quality in classrooms on learning of pupils in elementary and secondary schools. And what we decided to do was to basically collect all the information that was available published in the literature. Mind that 20 years ago, when we were publishing the first study, one of the first study on effects of indoor air quality on learning of children, that was sponsored by ASHA at that time, there was very few papers available on that issue. Most of the papers were coming from Professor Wyon and the work that he did in Sweden, mainly on the thermal environment and noise and the effects on children. And in the last 20 years, there have been many new publications, important publications that systematically, it's a systematic effects. They show that, by improving indoor air quality, increasing ventilation in classrooms, ventilation here is a marker of improved indoor air quality, and also by avoiding elevated temperatures and thermal stress or discomfort among the children in classrooms, you will promote learning, or I would rather say you will reduce the factors that disturb your learning. Because of course, learning is a complicated process, and there are several factors that influence it, and there are also several factors that disturb it. I mean, the noise that is disturbing can disturb your learning and how quickly you learn. The same happens with the air quality and the The same happens with the elevated temperatures or thermal discomfort. So by avoiding those, you will basically create an environment that is conducive to learning for children. And those effects are not negligible. I mean, we're talking about the effects of up to 20%. I mean, two cipher effects for both. So, and they, as I said, the studies are systematic. So, meaning we are seeing this in different continents, different groups, you know, and so on, and they are repeatable. And we see it across different types of measures of learning. We see it for the simple tasks that measure some cognitive skills to, you know, to results of the exams of what is called the end exams, right? And characters and the of year characters.
And you're seeing this globally, Pawel, as far as your research. This is, or are there certain areas around the world where there's more issues? I mean, I'm assuming that some of this has bearing on the building, the age of the building stock, the different educational institutions. You know, older buildings.
Well, it's very difficult to compare, of course, but yeah. I mean, interestingly, you have different, you know, countries. You know, Denmark, for example, where we ran the study. I mean, Denmark is more like, you know, very similar from the socio-economic aspects, whereas there could be some different, bigger difference, for example, in the United States and other countries, and those will be, of course, affecting the more the children which probably have I would call it less able to learn, and to call it mildly. So, but I would say we see it across, you know, the different countries the same way. Of course, there are very few studies from the countries in which, you know, which are very poor. There are few studies maybe from African countries where they have completely different problems. So these are not the same problems as we have here in the developed part of the world. So that is the difference there, of course. But in that part of the world, we see more or less the same problems.
Well, one of the studies that interests me was this one that you did about reducing classroom temperatures in tropical environments, which improved the performance of elementary school pupils. Can you talk a little bit about that study and what it was, its conclusions?
All right. I mean, there have been yeah, for the tropical. I mean, still, even for the tropical students, you know, the most important is to avoid the elevated temperatures. And here, what we see really, and we have more and more evidence that the effects here of the thermal environment are much more complicated than we believe they are. And they are not only associated with the thermal discomfort or thermal stress, you would call it, but also associated with the temperatures and the activation of our physiological response because of elevated temperatures. Of course, we need to more understand how the adaptation to the thermal environment, where if we live in the tropical climate or moderate or temperate climates, how it will affect, but that there will be effects. And even we see, you know, the students who are living in the subtropical climates, they will be affected by elevated temperatures. So they will not be tolerating, you know, 28, 30 degrees. That would not be acceptable for them. So that is the global phenomenon, is that, you know, you go from one climate to another and you see repeatable results here for children. So this is what is really interesting. Of course, the solutions should be properly devised for the different climates, and of course opportunities that there are, and of course the funding that is available there. But they all need help, or not help, but they all need the environment that will not disturb their developing process. I'm talking only about the aspects of learning, but there could be other aspects that we really need to look at as well. and this is their health. I mean, we have to remember that for many children, this is the most important part of their life, where they are still developing their physiological responses. And especially for the younger children, those in the grades from 0 to 3 or 3 to 5, remember that they are developing the skills on how to learn more in the future. And if this is not properly developed at that time, because the environment is creating, creating some handicap for them, that may have consequences, significant consequences for them in their future life.
Yeah. Well, thank you very much. That gives us a lot to think about in terms of
thank you.
Of this
thank you for
area.
having me. I will be back.
All right, we'll talk to you in a little bit. So our next guest is Froukje van Dijken. Do you want to do the introductions, Bob?
I will let you take this one.
Okay.
We're live. I didn't have it queued up for me. So not live television.
All right. So Froukje works in a consultancy in the Netherlands that specializes in indoor environment and healthy buildings. So she has schools and nurseries, and I wanted to bring her on to talk about that and to provide us with some information about these types of surveys. What can you tell us about the indoor air investigations that you do at schools?
Well, we do two types of projects in schools. Mainly, one is surveys in schools where they have problems with the indoor climate. And the other big group of projects is investigations or second opinions on building plans. So we're checking the design of new buildings or buildings that are going to be renovated, and check them if there are some errors we can take out before the school has been built.
So are you conducting indoor air quality sampling at these schools?
Well, not necessarily. In schools where they have problems with the indoor climate, we generally start with a survey in order to get the problems clear, which the people suffer from. And then the next step, we go into the building itself and we do investigations over there. We check the buildings. We check sort of building physics, HVAC systems. We take a look at the workplaces itself. How are they used? How is the interior design? Are there risk factors within the whole design of the building? And substantially, we measure. We can do measurements to get more into detail and to substantiate our findings from the risk factor approach.
I understand that you have some slides that you have given us. Maybe you could give us some description of what these slides are showing. Bob, if you could cue those up.
Yeah, well, this shows that it's not always necessary to do measurements in buildings, and using your eyes or your nose or whatever, it can be useful to see what is wrong in the building. And doing, for example, CO2 measurements, it doesn't say anything at all in these cases. What you see on this picture, it's the inside of a ventilation system. You see a filter, which hasn't been replaced for many, many years, as you can see. And in this school, they actually didn't know that they had a ventilation system. They just heard a noise from a gray iron thing somewhere fixed on a ceiling. And yeah, it was making noise, but there was no air replacement by this installation. And it's quite clear, yeah, you can see that it was all stuck.
Yeah, it certainly looks damaged, that's for sure.
Yeah. It had been there for a long, long time. Yeah, this is also a picture I'm often showing in presentations. This is actually an air inlet duct, which is in the floor. And as you can see, after I think 30 years, 40 years maybe, lots of rubbish came into this duct. And you can imagine that the indoor air quality is influenced by all the rubbish in there.
I imagine the one solution obviously is to do a little bit more duct cleaning than they've done in the past.
Yeah, sure. Well, it's not always about old buildings. This is a brand new building. This is the air handling unit, which has been used as a storage room for the builders.
Oh, excellent.
Yeah.
What are some of those devices? It looks like meters of some sort.
Yeah, and drills and that kind of stuff. All kinds of tools.
I'm sure that has an effect on the indoor air quality, to say the least.
Yeah, if you want to have a clean commissioning, this shouldn't be the case. This is also a new building, and what you can see here, it's the bottom of an air handling unit, which has been, it became dirty, some corrosion on the bottom. It probably gets wet every now and then. And well, filters are laying on the bottom, so probably there will be some mold growth in the filters. Okay, this is also not beneficial for the indoor air quality.
And these are all taken in schools in the Netherlands?
Yes, yeah, so in schools, yeah. Well, and one other thing we're always taking a closer look at, it's the cleanliness of ducts. As you know, probably the complaints of dryness of air, it's not about the relative humidity of in the building, but it's mainly caused by dust and dirt in the air. So that's why we always check the internal part of the ducts, of the air inlets. And well, as you can see, we love to write our name in. It's written BBA indoors inside.
You date
we like
as well.
to put some graffiti within the ducts, but it makes clear that this obviously is not clean.
What I find fascinating, I've been involved in my career a lot with the HVAC hygiene issues in North America, United States primarily, and we found similar circumstances in the public school buildings. But I was under the false impression, I guess, that in places like the Netherlands and in Scandinavia and actually a lot of the EU, that the hygiene was kept a lot better in the HVAC. So that's not the case, I take it.
Not at all. Maybe
Wow.
I still hope we still think that Scandinavia is much better than the Netherlands, but and the rest of the world. But well, I can tell you in the Netherlands, like I showed, this is more like a rule in all school buildings. Yeah, we should work on it.
So what are we looking at here?
Yeah, I thought it's all the other pictures were showing indoor air quality issues, but it's not only about indoor air quality, also temperature you can sometimes visualize. As you can see here, it's a radiator, convective heating, and this is in a school as well. Lots of books are put on this radiator, and well, as you probably know, the heat won't come out. So in this classroom, indeed, it was too cold.
No surprise there, I guess. If you cover up the radiator, you're not going to get much heat. That's for sure.
Yeah. And this is what we often see. So we don't always need to do measurements. Pictures like these sometimes are more clear. And the previous picture about the inside of the duct, the dirty duct. You don't have to measure how much dust and dirt is in there. I think a picture like that is more clear for the users of the building, and to convince people to clean the ducts. Or a picture like this, well, clean up, make space. Yeah. On this picture, it's I think it needs some more explanation. This is a school building, also quite new, but they only had one window sling in each classroom. You had to take it off and move to the next window, and because it's loose, they got lost. In the beginning, there was one sling per classroom, and now there's one sling per corridor, something like that. So if you want to open your windows, you first need to find such a sling. Yeah,
that's problematic.
Yeah, and most school buildings, older school buildings in the Netherlands, they don't have cooling. So this is your cooling. You cannot. You don't have cooling if you cannot open your windows.
No, there's not much in the way of natural ventilation if you can't open the windows.
Yeah, this school building had mechanical ventilation, but they were lucky. But we see these kind of situations in schools where they have only natural ventilation as well. Yeah.
And I noted that that in one of your presentations, you stated that 80% of Dutch schools had insufficient ventilation. Can you tell us why that is the case?
Well, until the late 90s, I think schools in the Netherlands were built with natural ventilation systems. So we only have windows that can be opened. If you do not open your windows because of draft or outdoor noise, you do not have ventilation. So it's mainly a practical problem or a comfort problem. We do not have ventilation. Most schools have enough windows, but they cannot be used in practice. Since the 90s, the past decades, we made a move to mechanical ventilation. But budgets are very low for building schools in the Netherlands, and there was no. We were not used to build mechanical ventilations at low costs, and that it showed that we have problematic results with that. Fortunately, since the last about 10 years, we have more focus on on ventilation, the need for good ventilation in schools. And I think at the moment, this 80% is not actual anymore. It's going down quickly, but I think 60-70% of the schools is still not good enough.
Yeah, that's a high number. I mean,
yeah,
that's saying that 60 or 70% of all your students potentially, right, are not really experiencing a good environmental quality for learning.
Yeah, that's a sad reality.
Yeah, I mean it's true here in the United States as well. And Don, I'm anticipating in Canada probably not that dissimilar.
No, it's very similar actually, and the problems in the schools now in Canada is that many of them, are as much as a century old, and so putting any type of ventilation other than natural ventilation is really difficult in these older schools. So it's very similar problems that we have, probably again worldwide. So one last question. I was wondering, I understand you're the author of the Dutch guidelines for IEQ in schools. Could you tell us a little bit about those guidelines?
Yeah, about 15 years ago, I think, we started to have the discussion in the Netherlands about the indoor air quality in schools. And we began to notice that the situation was very poor in our buildings and we should change that. And at the same time, there was a discussion starting on sustainability and energy use in schools. And of course, saving energy, it saves money, and it's really attractive for schools to save money. But at the same time, you want to improve the ventilation, improve the indoor air quality, and of course, if you want to have more ventilation, it costs energy. So combining both, the Dutch government said we should make guidelines to help schools to save both energy and improve ventilation, and we should make guidelines for schools and help them to improve the quality of the building. And back in 2008, I think we had the first version of these guidelines, and it became really successful. Actually, at the moment, no school in the Netherlands is built without using these guidelines. And the government, local governments, actually often give extra budgets for building your schools if you build it according to these guidelines at a certain level. So actually, we are quite successful with these guidelines. And this week, we actually launched, it's the 6th version, I think, version 2021. So we are glad to promote that as well.
Right, and I imagine that they're available somewhere on your website or some other website that we could, anybody who wants to find those could find those.
Yeah, I will put it in the chat.
Perfect. We'll get it on the show notes.
Yeah.
That'll be attached to everything.
Yeah.
All right. Great. Thank you very much. Great
your Dutch skills.
So before we bring Pawel back in, I just wanted to take a moment and mention an upcoming event this fall that will be focused on bridging this gap that we're trying to do here, bringing the academic research side to the practitioner side. And this is the Healthy Buildings America 2021 event. It's being held in Honolulu, Hawaii, November 9th through 11th. This is going to be an in-person event. It is of course being sponsored by ISIAQ, the International Society of Indoor Air Quality and Climate, and it's being hosted by CIRI, the Cleaning Industry Research Institute. So this is an event. We'll be there, right, Don? You're planning on being there.
I'll be there. Yeah.
So this is an event that we highly recommend you check out. This is absolutely a one of a kind type thing. So at this point, we're going to bring Pawel back in. There he is. And we'll continue this discussion. I mean, this is actually fascinating. I have to say, let me just frame this, coming again with a North American and predominantly United States perspective on things. I thought a lot of the issues that we had here were more unique to us than in Europe and a lot of other areas. And I'm beginning to see that's maybe not the case. This is more of a systemic thing throughout schools throughout the world.
Yeah. So, Pawel, I mean, your research has been focused beyond the Denmark and Scandinavian countries. You mentioned, we talked a little bit about subtropical and tropical. Do you see differences between, say, for example, what is going on in Europe and, say, for example, what's going on in North America? I know you have correspondence back and forth. So what's your thoughts about the differences and the similarities between the two places?
Well, to be honest, I don't know much about those similarities and differences. What I can say about Denmark or our initiatives here is that it seems like indoor climate in schools is back on track here. So after years of discussions and so on, there has been some significant investments that are made by local municipalities in solutions for improving indoor environments. So, and probably to which extent they are, of course, emphasized by the current pandemic, it's difficult to say, but they have been in plans for years. And Froukje is right. I mean, for years we have been, and I think this is the similarity between different countries. We've been looking for the savings, and where to find best saving is just, let's not upgrade schools. I mean, children will anyway treat it as a part of education to be in the poor environment, right? You can say that. So that is probably the biggest overlook that we had over the years, and now we see the consequences of that. Right, during the current pandemic, the schools could not be open because they did not have systems or technical solutions that would allow them to open and keep children going to school. So that was a significant overlook, and I hope it will be changed in the future. So that's my comment on that question.
Would you like to add anything, Froukje, in terms of what you're seeing in your schools in the Netherlands and other places, perhaps in Europe or in North America?
Well, at least in the Netherlands, we see that, like in Denmark, we are expecting big improvements, or at least investments in the school environments. Due to the pandemic, last September, a huge measurement campaign started in the Netherlands. Within 4 weeks' time, the government started to measure the indoor air quality in schools. It was 30 degrees outside that period. So it's not probably not the best results or the most reliable results. But after this measurement campaign, they revealed a subsidy campaign, and now schools can have subsidy to improve the building due to this, due to the pandemic, actually. But it was necessary anyhow.
It's unfortunate, though, that it took a global pandemic to actually create an impetus or some sort of motivation to actually improve the air quality in our schools.
Yeah.
Not a great commentary on where our priorities are. I mean, do you both believe that going forward, as a result of the pandemic and as a result of the probably renewed interest in air quality and ventilation, especially in school buildings, do you see this going forward, or is this going to be like a one-off type thing where there's some funding now because we're still in crisis, or do you think this is actually going to be a paradigm shift going forward?
Well, we do hope for the paradigm shift.
Yeah.
And as you know, on May 13, I think on May 14th, the article was published in the Science, where 36 researchers ask for the paradigm or request the paradigm shift. And the paradigm shift in our thinking about indoor environment is that the health should be one of the important parameters. That, I mean, indoor air quality should ensure that the environment is healthy, and that infection control and quality of the air, considering infection, should be considered. I think the most important thing here at the moment is for the authorities to take an action on that and ensure that those requirements are in the regulations, building codes or building regulations, standards, and the guidelines. For example, if you look at the WHO air quality guidelines, they do not mention infection control, right? And the list of pollutants is only like 12 indoor air relevant pollutants, including also several from outside, and maybe 15, 16 pollutants. I think we should at least start to and comply with those recommendations, and of course make sure that the indoor air quality contain the aspect of health and not only comfort in the requirements, and infection control. The other important issue is the accountability here. I think when I was looking at Froukje's presentation and pictures, and you were asking about the ducts are dirty, and we thought that it is only a US phenomenon, and it's phenomenon everywhere, because there are no proper regulation for servicing of the systems and ensuring that they are working as they are designed. There are only few in the world. I mean, there is one in Sweden where they have a regular maintenance checks of the ventilation systems. This kind of changes are necessary for the future for the success. But as I said, I think one of the important things is that the authorities should really, take the difficult decision. In Europe, what is it? What was about 10 years ago, the decision was made to stop, to ban smoking, in public buildings, and we see now the effects of that. I mean, there are significant positive effects of that. I mean, we have to make this decision. Someone has to have a courage to do that.
So I was going to ask Froukje about these measurements that you mentioned that took place last September. What were they measuring? What were the parameters that they were measuring, and how were they selected?
They were mainly CO2 measurements, and it was a kind of do-it-yourself method. Because in Holland we have about 7,000 school buildings for primary and secondary education. We do not have enough engineers to measure all those buildings within 1 or 2 weeks. Mm-hmm. So that's why schools were encouraged to measure their own buildings and using consumer equipment like those traffic light CO2 meters in order to get the results of their, or get at least a random sample within their classrooms.
And what was the guideline that they were using for, say, carbon dioxide? What level was considered to be acceptable and what was not?
They used several guidelines, actually. 1200 ppm as a lowest value, and which is actually, that gave some discussion. 1200 ppm is actually above the Dutch guideline, or the Dutch guidelines in schools. I think if you follow the guidelines for older school buildings, you will have CO2 concentrations about 1800 ppm. Mm-hmm. But 1200 for these older buildings was set as a guideline. For newer buildings, it's 950 ppm.
Okay, and were they selected by a group, or how were they? How did they evolve to those numbers?
Based on the guidelines we wrote, actually.
Ah, okay. So it's all your fault that they don't make it.
Don't discuss these guidelines.
That's right. Pawel, you have been involved in the EHC committee and under from ASHRAE. You know the discussion about carbon dioxide. What are your thoughts on this in terms of measurements and what type of guidelines?
Well, I need to introduce my plenary talk for Healthy Buildings Europe, in Oslo, that I gave last week. I think it will be available online for those who will register, maybe at the lower cost than the full registration. Nevertheless, I was talking about the CO2, about it, how it is used, in which context it is used. Well, my opinion about CO2, it's a crude measure. And it's crude measure that we have to use it properly if we want to use it. And so it gives us some proper indication. However, we have not yet developed another indicator. And there is not much, to select among. If you want to demonstrate whether your environment is, whether your ventilation is working properly and are there any risks and so on, it seems to me that that is probably the only parameter at the moment, which is for which we have an experience, for which we have sensors, and which we can monitor. However, there are several issues that are associated with it, and in different contexts. In the context of measurements of ventilation, proper location of the CO2 sensor and CO2 sensor in itself, proper calibration, and so on and so on. These are the elements of the actual precise measurement. But but CO2 indicator or CO2 may not be a very good indicator if you, for example, use air cleaning systems, right? So that is the issue. I mean, now when we speak about the COVID-19 pandemic and when we use air cleaners, HEPA air cleaners, we will remove the infectious pathogens or pathogens from the air, but CO2 will remain unchanged. So CO2 will not be a good indicator in this context, for example. In large areas, in large volumes, also will not be a good indicator, and so on. CO2 may not be very well related also to our respiratory activity. We don't know that. This is something that we also need to study more. But as I said, we should not condemn CO2 because at the moment we don't have an alternative. And so let's use this measurement as a properly and provide the good guidelines for the people how to use it, because we just believe, okay, we can deploy some sensors and everything will be fine. And there are no guidelines for that. For the numbers, if I just say something, there is this important issue, is this 1000 ppm of Pettenkoff. This is like an indicative of whether environment is good or not good, or air quality is good or not good. So it seems like it is somewhere there. I mean, maybe it is 800 or maybe 900. And also we need to start thinking about the CO2 above outdoor, because outdoor levels of CO2 are increasing. Interestingly, when Pettenkoff proposed 1000 ppm, he assumed outdoor level of 500 ppm. So actually he was saying 500 above the outdoor level, which today with the 400 outside, maybe sometimes more than 400, would result in about 900 ppm, right, indoors, which is probably the levels that, for example, we for schools, we say that, the levels around 900 and below, they would provide the conditions which will not disturb the learning. With respect to air quality, why 900? Because we don't have, the school air quality is not better than this level, so ventilation. So we don't have data for, lower levels. Maybe there are still effects below 900 ppm. So 1000 seems to be 900, 1000, or Froukje is saying 950, right? Seems to be somewhere a ballpark, indicator for indoor air quality level and ventilation. However, again, we need to develop a proper guideline for the people. It's not like, you plug in this thing. It's much more complicated.
Well, what's interesting too is because there are two discrete different concepts here, right? Using CO2 as an indicator is dealing mainly with gaseous contaminants, right, and off-gassing and that sort of thing. Whereas, specifically with the pandemic, we're doing, with an aerosolized pathogen, we're doing particulate removal. So we can do all the HEPA scrubbing in the world inside of a classroom, but we're not going to improve the indoor gaseous concentrations in there with those HEPA units unless there's some activated carbon or some other sorbent there. So I think it's more complex than some people realize.
But even if you think about, climate change and a need to reduce energy use and use of the gas phase air cleaning, systems, which may become popular, and particularly in some locations, it will be much easier to maybe deploy the gas phase air cleaners than increased ventilation. Then we have the same problem, because they would not remove CO2 from the environment. So we need to somehow connect their operation with the some sort of a CO2 equivalent change or something like that. I would call it CO2 credit, and I call it like this, CO2 credit. And of course, CO2 should be supplemented with other pollutants. I mean, CO2 would not correlate with the ambient pollution level. So your CO2 will drop, but your ambient pollution levels indoors will increase, so you improve ventilation in the areas where the PM levels are very high. Maybe ozone is high outside, and so all of it you bring inside, but CO2 will not indicate that. So this is something that we need to supplement the sensor with.
So Froukje,
yeah.
Froukje, I was going to ask you, what did they do with the schools with the subsidies they got once they were, did their self-checking in terms of the CO2? What were they doing with the subs? Were they doing better ventilation? Were they doing something other than that? What did they use the money for?
I think mainly ventilation, improving the ventilation system, but they can also use it for improving overall sustainability, so lower energy use.
Okay, so lower energy use, but would that necessarily result in lower levels of carbon dioxide levels in the classrooms?
Nope, but reducing of CO2 levels or improving ventilation rates is one of the main things you should do. It's how to say it. Well, if you don't improve the ventilation in your school, and if you do not monitor CO2 levels afterwards, you won't get the money.
Right. Well, in some cases, if they're using it for energy reductions, it may not be a good use for that subsidy at this point if they're really trying to improve indoor air quality. But that's true all over. I mean, it's not necessarily just true in the Netherlands. In the United States and in Canada, we have the same situation where people are talking about sustainability and resilience. And so many cases it goes, where does it go? It goes to improving the ventilation in some cases, but a lot of energy savings in a lot of other cases. So the same type of problems exist here in North America as they seem to exist in Europe. So, Bob, any other questions?
No, I mean, I think my big concern again is that, and I've voiced this on so many different programs, that we have this, I think, a unique opportunity right now in the world, coming off, or still, I shouldn't say coming off because I'm speaking in terms of the United States now, but let's say getting toward the waning, hopefully, time for this pandemic. There's just an elevated awareness, not just among the indoor environmental community in schools, but just the general public, right, about indoor air quality, indoor environmental concerns. Everybody's highly focused on that, more than I've ever seen in my lifetime for the general public. And this is a unique opportunity for us in the industry, both on the research side and in the practitioner side, to drive this point home and maybe drive some new initiatives and maybe have a paradigm shift in the industry. My concern is that will we do that? Will we seize this moment that we have right now where there potentially is funding and there potentially is interest to do that, and if so, how do we do that?
Yeah, how do we?
That's a loaded question, I know.
And how do we measure if it's successful or not? So it's difficult. Pal, I have to ask you because it just struck me that you have some recent studies that I've seen concerning bedroom ventilation. And I was wondering, since that's more of an indoor air quality for not only for adults but for kids as well, perhaps you could describe a little bit what you're doing in terms of this area of expertise.
Sure. I'll be happy to. But just to address what Bob was saying is, I think there are two possible paths here, and one is, as I said, is authority that taking step forward and just saying, okay, it's been enough. We have to do something about it. And then, of course, the an interest, general interest, so from bottom up, that the interest to make the change. I don't know whether there is a strong push in this direction there. I think it's important is that, the paradigm shift is also, in how we think about our buildings, how flexible and resilient they should be for the possible different events that we may have in the future. And this pandemic actually clearly shows, and also other events, the wildfires in California show how they are, unprepared to this kind of events. But let's hope for the best, I think, Bob. And then for the sleep, right? I mean, if I say, first I will say about Pettenkofer again. So he said that 1,000 ppm in all other spaces except bedrooms. In bedrooms, 700 ppm, because the air quality should be much better in bedrooms than in other environments. And And this is what we try to do, is now we try to figure out how indoor air quality in our bedrooms affects our sleep quality, and if so, what should be the prescribed ventilation requirements or other measures taken to improve the indoor air quality in bedroom. I just tell you a few words about sleep. We sleep about more than 20 years in our life. You know, it is a significant part of our life where we spend in one environment. This is fairly static environment because we sleep. So we can document what are the exposures that we have there. And we have documentation that poor sleep quality affects several aspects of health, including, you know, there is a connection to obesity, to Parkinson's disease, and other aspects. Poor sleep quality affects next day performance. I mean, they compare poor sleep quality with few drinks taken in the evening and driving a car. You know, after that, you would probably, without good sleep, you will be as risky on the road or as dangerous on the road as after having a few drinks in the evening in a bar and driving home. So this is a very important environment. We understand now how temperature is affecting this, but with the new methods to measure sleep quality, with you know, sleep trackers that can monitor our sleep quality basically online 24/7 without a need for the going to the specially prepared sleeping labs, we will be able to monitor how people sleep in different conditions. So this is what we do. We have completed we make measurements both in Denmark, which is a temperate climate, and in China, which is in the subtropical part of where there is a subtropical climate in China, in Shanghai, just to compare the differences in, first of all, building culture, and also that the climate. And we look at we measure the conditions in bedrooms, in actual bedrooms, and then we plan now for the studies where we actually make interventions in bedrooms and see whether they would be having any effect on the sleep quality. Our aim is to provide some guideline value where we should be with the ventilation. With all the published data, we published a paper recently in ASHRA Journal on that aspect. With the published data that is in the literature is very limited, but it seems like the 700 or 800 ppm of CO2 that was recommended by Pettenkofer, and again, we are talking very close to 1000 ppm, you can see, for the CO2, because we have data for measurements of CO2. This is the way how we measure the air quality as an indicator. It seems like this is the level which we should aim at in our bedroom. So for those who are watching us, I mean, make sure that your bedroom is properly ventilated when you sleep tonight, and it will guarantee you good sleep.
And will be very much more productive tomorrow morning too.
Yeah,
there you go. Oh, but that, you know, you point out a great problem there, Pawel, because most people, or many people, sleep with their bedroom door closed, and many home residences are designed without true return ventilation on their system. So it's designed to go through the doorway. So you've cut off most of the ventilation by closing the door, potentially. Yeah.
Moisture increases, temperature increases, you know, air quality is reduced, and then you wake up, you have, you know, you may not have the proper length of all the stages in the sleep. You wake up and you don't even know that you wake up during the sleep, because you have to turn back and forth, because, you know, the conditions are not helping you to sleep. So it's an important problem, right?
Yeah.
And to get adding on top of all the stress that we have from the outside environment and life changes in life, right, which already reduces our sleep lengths, then this will further introduce the disturbance to sleep. So at least this we can control this at least.
And for children, if they don't get proper sleep, they'll end up sleeping in the classrooms, which is what this is all about today.
Right. And also for the children with asthma and allergy, they improperly ventilated bedrooms. This is, you know, our group showed that they would exacerbate their problems, and that would also not only affect their health but also affect their sleep quality.
Well, Bob, I think we've come to the end of the program.
We've gotten to that time. I guess what I'd like to do is give you both an opportunity, both of our guests, to give a brief final statement, final point you want to make, or something you didn't get to state. I'm going to reach the Froukje first. Closing thoughts?
Yeah, I would like to encourage everyone not to wait for more scientific knowledge. We know a lot already. We don't know everything, but use everything in practice. Use your senses and improve all those school buildings.
What an incredible punchline. I think we, of course, as a researchers, we would like to learn more and more and more and more, but there is sufficient information for the practice to act on it. And, Professor Wanger was always saying that the Wright brothers, they did not know all the, all the equations and, relationships and everything related to aerodynamics, but they could fly. I think we can also fly here by changing our indoor environment with the evidence that we have so far. Of course, we will be developing it further to improve the solutions, but we can already now, with the evidence that we have, as Froukje was saying righteously, that we can make a huge change to how the indoor environments are created, and for the benefit of all of us, not only children that we speak today, but also for elderly and us, sitting here. Thank you, Froukje, for making this line.
Well, Froukje van Dijken, Pawel Wargocki, thank you so very much for joining us and taking time out of your evenings, I guess, right? Both of you are at the waning parts of your day. We're just beginning here.
Thank you, but it's a long days we have, because it's June and we have long days. I mean, so it's just the beginning.
Well, yes, thank you to both of you, and we will certainly take the thoughts that you had. You can never go wrong, Pal, when you quote Professor Wanger as one of the last statements. He was
I just give an example because it was excellent analogy. I mean,
yeah, it was, and he's unfortunately no longer with us, but his thoughts are still, influencing a generation after generation of people who are involved in this field. So thank you very much to both of you.
Thank you.
Thanks for the invitation.
Thank you for the invitation.
Thank you.
Yeah.
So Don, we are at that time. We've gotten through episode number 1, which has been great.
Yes.
This has really been a great conversation. I was, came into this going not 100% sure exactly where it'd go, but I think it was fantastic.
Yeah.
Before we leave, want to definitely put a reminder out there again for ISIAQ's Healthy Buildings America 2021. That's happening this November 9 through 11 in Honolulu, Hawaii. And the focus of this is bridging the gap between research and practice. And the intent here behind the organizers' plans is to bring practitioners and researchers together at an event where they can interact and share experience and information. This event, again, is being hosted by CIRI, the Cleaning Industry Research Institute. And we'll all be there, right? You'll be there, right?
I'll be there. Yep.
Yeah, I mean, I'm going to be there. I'm planning on it. So I guess without further ado, we'll say, everyone, thank you so very much for watching the show. Again, this was a joint production of ISIAQ and IEQ-GA, and we'll be back again in July with our next guest. One of our guests, at least, will be Dr. David Kraus. I believe he'll probably be speaking at least a bit about Legionella. It's kind of his bailiwick, but stay tuned. We'll be here every month. The show, again, replays of the show are available at the Healthy Indoors online global community. You can watch it anytime. It's free to the general public. And by all means, join the community and comment there. We'd love to see what your comments of this initial episode are. So, Don?
Yes, thank you, Bob, for helping to put this all together. I certainly would not know what to do in terms of what we've done in terms of the production value. And I really appreciate what you and Susan have done, and I'm looking forward to the next show.
Excellent. Well, we'll see you all in July for the next episode of Indoor Environments, Global Research to Practice. Until that time, I'm Bob Krell, and for Don Weeks, we'll see you soon.